Thank you very much, Eva. So I'm Ina Asklund, and my topic today is about women's experiences of using internet and apps for treatment of urinary incontinence. So why could it be interesting to do qualitative studies and interviews with women? Well, we think that once we've seen that a treatment can have a treatment effect, we also want to understand how this effect works and why it worked. And also we want to improve our treatments, so we wanted to improve our internet and app programs, and therefore it is valuable to hear the women's experiences. And also we are planning future treatment programs for other kinds of incontinence, and then it is also important to have the women's experiences about what we can do better in the future. So, a short description of the randomized controlled trials that we did. First, we performed an internet treatment, and we compared that to a brochure treatment. And in the follow-up after 3 months, we saw that they had improved regarding symptoms and quality of life. Both groups had improvements. In this internet treatment, women also had email contact with the urotherapists. And after the RCT results were, we also interviewed 21 of these women, selected number of women, and performed telephone interviews, and we analyzed them according to principles of grounded theory. And these results are already published a few years ago. From the interviews of women using the internet, these are the main categories that came up in their answers. First, hidden but present, the women's experiences of living with incontinence. Then it was at a distance but close. There women described their relationship to the care provider, and in this case the care provider there, they meant the urotherapist that they had email contact with. They never met with a care provider. And then a third category was by myself but not alone. And all these categories emerge into a main core category that we called acknowledged but not exposed. And in summary, that was that women with incontinence might feel alone and exposed, and participating in a treatment made them feel acknowledged, supported, and more in control. And then we performed this slightly different study with an app treatment where women did not have any contact with the care provider, nor they didn't see anyone face to face, and no contact via mail or telephone. And then we randomized women to treatment with this mobile app that Eva talked about, TÄT, or to no treatment. And we also did follow-up after 3 months, and it showed that women using the app improved regarding symptoms and quality of life and other measures. And after this follow-up, I interviewed 15 selected women that had used the app. These results are still a little bit preliminary, but so far 3 main categories have emerged. The first one we call the app was an effective and easy treatment. Women spoke about that the app helped them in their motivation, supported them, reminded them to do their training. The second category is new technique changed women's attitudes. Women experienced that with using an app as a treatment tool for managing their incontinence felt less taboo and more prioritized. And the third category we call women felt confident and capable of self-treatment. There were some worries among the women if they were doing their training correctly, but to summarize, they felt that they were competent enough to perform this treatment without the face-to-face contact with a healthcare provider. And one woman, here's a quotation from one woman about using an app as a treatment tool. And she said that, yes, I think that's mainly it. It's easily accessible. It's right there, and it's a constant reminder. And in conclusion, women experienced that the app is an easily accessible and effective and modern treatment option, and it supported and motivated them to self-manage their incontinence. So our conclusion from both these qualitative studies on the internet program and the app program is that treatment programs for stress urinary incontinence delivered via internet or app are effective and also appreciated by women. And they experience these treatment programs as easily accessible, first-line options that can support and motivate them in their self-management of incontinence. So, as you can understand, we see many possibilities with these kinds of e-health and m-health solutions. They can maybe lower the barrier for health seeking. If we can reach this population that might not even come to primary care, maybe we can reach them with this kind of treatment programs. We also know that smartphones are part of everyday life. People carry them with them at all times, even during night. So it makes it easier to use them as tools for reminders, and maybe it can also help with the adherence. And also it was quite interesting, the thing that we heard from some women, that they felt that by using a new technology, their incontinence problem felt a little bit less embarrassing and more easy to talk about, at least with their close friends. But then, of course, we have also experienced some difficulties. For example, many women describe that it was very fun to see the app for the first time, using it the first month, but then the third month it wasn't really that interesting anymore, a problem that we can all recognize. So how can we try to keep the motivation up for training? And then also, how can we support and confirm women's progress? Many women felt that they wanted someone to coach them and tell them if they were doing, or not necessarily telling them, but they wanted some kind of confirmation that they were doing, that they were proceeding in a good speed, or that they were training as hard as they should. And how can we do that with e-health and m-health solutions? And also, how can we give advice if the treatment doesn't work? Because, of course, not every woman in our studies got better, and how can we support them to have other help? And that was what I wanted to say about our experiences, and we will. You can have questions to me, and then we will have the general discussion. But just to start this discussion and the questions, we will try one of these Mentimeter questions again. We will try to see if it works. We'll take some time, so if it's possible for you to enter this Menticom. And the question was now, what would motivate you to perform pelvic floor muscle training regularly? So there's some options that could help motivation. The first one was individualized feedback about my training in my smartphone. The second answer was a training program designed as a game. We heard something about gamification here. Third response was sharing my exercise statistics with my friends and compete with them. I had a few women who wanted that when I interviewed them. And also, fourth answer here was having regular appointments with a healthcare professional. And you can answer several alternatives. Okay. Some are more competitive also. Okay. So what we can see here, I think, from your answers is that there are different things that can motivate different people, and maybe several things can motivate the same person. And these things these are things that we are thinking about when we want to improve our apps, for example. And I know there are so many different solutions for this. Someone was talking about push messages, which is one example. So thank you for sharing this. And now, please, if you have specific questions to me, or otherwise we can also start a little bit more general discussion.
My name is Ewelina Malanowska, and I'm from Pomeranian Medical University in Poland. I just want to say that the applications should be additional thing to general examination, because in my experience, it is not possible to do apps without healthcare assistance, and I usually Okay, so I usually use this app with the patients. We are cooperating together, and then we can discuss the treatment method and how me and patients see the results. Is it effective or it's not effective? And I think that healthcare providers should take part in this investigations in apps, and it's important for patients. And sometimes the patients struggle to answer all of these questions, and they need assistance to explain questions and all these things what we can find in apps. So also the results, yes. And about the data, I would like to say that there are apps when we can store the data. For example, in our clinic, we invented an app which can store data, made a basic analysis, and then you have the results which you can discuss with the patients. But to talk about the scientific significance, we have to consider the questions, for example, from validated questionnaires, for example, PFDI 20, PISQR for sexual activity, and then we can gather data, scientific data, which results are more reliable. Okay, thanks.
So you mean you can also gather this, they can enter these questionnaires also in the app, you mean? Or you do it together at the clinic?
There is a program, rather a software or application, where we ask questions from 3 validated questionnaires, and but we are interviewing patients, and then we have the results. The results are exported to the Excel, well-known program. And then you can access the Excel to any attainable program worldwide, for example, MATLAB, which shows you the charts, and then you can depict the results to the patient. But all the data are gathered in the internal database. But of course, our purpose is to share our software with the colleagues from another clinics, and to make a tool which can in the future be a decision-making tool to qualify patients, for example, to operation, because I focus on prolapse surgery, so it's very important how to qualify patients for the surgery, and the questionnaires, validated questionnaires for pelvic prolapse and urinary incontinency are very needful really needful. Okay,
yeah.
Thanks.
Well, I think that's also a way that many people view the use of these kind of apps, that they have it as a complement or a support tool and so on. And what we did was a little bit different, but there are many ways, I think, to use this kind of technology. Eva?